Good afternoon. Today is March 24, 2003, Friday. This is Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I'm here with Dr. Isaias Irgau, as usual. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's great to be back on Bariatric Friday, something I look forward to every week.
It's always good to have you, and we are going to discuss another part of bariatric surgery process. We do this on a weekly basis. And we'll keep doing it for our patients and for people out there who are struggling with morbid obesity, because we know that those individuals who are not getting a lot of support, and our goal is to provide more support with these events. And I believe we are doing a decent job to do that. Not only that, not too many support available, and our program is one of the maybe only one who does these types of events on a weekly basis, with a surgeon and executive who's experienced in bariatric surgery. So hopefully everyone can enjoy what we are going to cover today. We are going to cover maintaining weight after bariatric surgery, because what we see is because bariatric surgery is extremely efficient. So now all of a sudden in the first 6 months, someone may lose 100 pounds. So then how are we going to maintain that? So are we going to go back to our old habits? And what can we do not to get to that point again? How can we take precautions measures to make sure that we maintain the weight after surgery? So Dr. Irgau, we are with you now. So you're going to tell us what needs to be done after the surgery.
Absolutely. This is obviously a very important topic, Kemal. Most of our patients will come to bariatric surgery after they have spent a lifetime struggling with their weight, a lifetime in which they have, lost and gained the same amount and more weight time and time again. Every time, they lose the weight, then the disappointment occurs when it takes very little time for that weight to come back. With this type of clearly, almost traumatic experience with weight, it's not surprising that, one of the biggest fear of most patients after bariatric surgery is weight regain. Will it happen again? The good news is bariatric surgery is extremely efficient. Bariatric surgery is extremely resistant to weight regain. Having said that, it's not foolproof, again, because the problem with obesity is a biologic problem. There is an entrenched drive for our body to gain weight. We are wired to gain weight. And this has to do with our evolution, because as humans, the greatest part of our existence, we have spent it really struggling to find food. So we have developed a body that has become extremely efficient in using whatever food it can for energy and preserving it. When you ask a modern person, how do they preserve food, their immediate answer is the fridge, right? We have the fridge. I can keep food for a very long period of time. But the truth is that the fridge and other technological advances happened just, yesterday. When you think about the human history has really occurred over millennia where there was no way for people to keep food fresh, right? So they had to find food, eat as much as they can when they have it, and have a body that was good at preserving that. So the body that we have evolved is extremely good at gaining weight, but it's very, very poor at losing weight, right? So, and that's why, you see people really work very, very hard for months on end to, lose 20, 25 pounds. And it takes barely a week or 10 days of loss of focus for the weight to come back, right? Because that's what our body is. So given that our biology is such, it's not surprising that even after bariatric surgery, weight regain can happen, and it does happen. As you said, typically this starts about a year to 18 months after bariatric surgery. The first year to 18 months, there's almost mindless type of weight loss. Of course, there is the focus as well. Patients And, people who had bariatric surgery are very excited and they are focused as well. But really, the biology that bariatric surgery interferes with is really effective in that early time as well. After that, things can happen that really can derail that. As I said, people may lose that initial enthusiasm, right? That honeymoon period, may recede and they may go back to routines. But on top of that, the body's biology starts to become entrenched. So at that time, there is a danger for weight gain. One thing that is very important to mention, Kemal, is that we have to define what weight gain after bariatric surgery is. And I have to tell you, for people to regain all their weight is actually unusual. It's not common at all. There can be significant weight gain, but for people to gain all their weight after bariatric surgery is not common. What is more common is for people to regain some degree of their weight. Now, they can regain so much that, maybe half of what they've lost can come back, right? Sometimes even more. So from a layman's perspective, when they see people who had bariatric surgery and they see them reaching their goal weight, let's say at 18 months, right? A person who was 250 pounds, now a year later, they are 150. They're the thinnest they've ever been, right? When other people look at them. But if that person were to regain, let's say 30 pounds over the next few years, from the layman's perspective, they're just comparing them to when they were so thin. So from their perspective, it's as if they have failed bariatric surgery. But that's not true. They're not 250 anymore. They may be 170 and 180, which is way better than being 250. So that's the weight regain that we see with bariatric surgery. It's very important to understand that. And of course, we can go into detail as to why that happens and how can patients actually prevent or minimize that weight regain after bariatric surgery.
So I know eating slower or slowly helps, right? So is that something related to like the mindful eating, like when we are eating? So is that the same purpose, or is there a different reason for eating slowly in the process to keep the weight off?
Well, that's actually a great point. Mindful eating is really a wonderful, wonderful tool, Kemal. The problem is, in our society, we are so distracted that it is very difficult to maintain that discipline day in and day out, right? If a person was mindful enough to know that they've had enough food, in other words, they are eating with really paying close attention to what their body is telling them, then they would be able to be in control all the time. But eating is not a practice that we do in by itself, right? It is really mixed with many other multitasking activities that we have in our day, typically socializing, whether interacting with the media, watching something. That's how we eat. And in that process, it's very easy to get lost and not really listen to our body. So our body, particularly after bariatric surgery, does tell us that we're full. In fact, Kemal, there is this myth that people have that, people gain weight after bariatric surgery because their stomach has enlarged. That's actually not true. It's very occasional that the stomach is so large now after surgery that weight regain happens because of that. It's very rare for people to have weight regain because they have problems with their surgery, right? Their stomach, for instance, after gastric sleeve, that was really very tight and small, remains tight and small for years, right? In fact, when you talk to patients who are struggling with weight gain and you ask them about their eating habits, they will tell you they still cannot eat anywhere near what they used to eat before their surgery, right? But what happens is they fail to listen to those signals, right? So for instance, at the beginning, let's say, early after surgery, somebody who's had sleeve gastrectomy, they are sitting to eat, right? It's early after surgery, they really are focused, they're in that honeymoon period, so they listen to their body. So they may feel full, for instance, after taking, let's say, 10 bites of a particular food, right? And if they were to add the 11th bite, they may actually feel discomfort, right? Now, for somebody who hasn't had surgery, Kemal, the difference between fullness and discomfort is a full course, right? I mean, you and I who haven't gotten an altered stomach when we go to eat, before we feel uncomfortable, we really have to eat a full second or third course, right? But with bariatric surgery, it just takes one extra bite before you feel uncomfortable, right? So the difference between feeling full and uncomfortable is very, very close. It takes 1 or 2 bites to do that, right? So at the beginning, they may pay attention to that. But if they are distracted and they don't pay attention, now it may, after a while, that bite number 11 may feel comfortable, may be okay, right? And then they may do that with bite number 12. They may do that with bite number 3. So before they know it, now they're consuming 100, 150 calories in excess with each meal. And those calories add up, right? Our body, which is so well adapted at conserving energy, at gaining weight, will suck in all those extra calories day in and day out. And before they know it, within 6 months, they've regained 10 pounds. Within a year, they've regained 20 pounds. And that is a very hard situation, because now coming down from that is actually a lot harder than when they start. So this issue about mindful eating and really, really focus on when you feel full is just as important as after bariatric surgery as it is before, when you're struggling with weight, with being overweight.
So I want to kind of give you, maybe I told you this before, probably in our one-to-one discussion, I probably told you, but one of the issues that I see, so as you know, like I'm one of 4 kids, there was this chocolate bar my dad used to buy for he comes home, after he's done working, and usually, let's say it's around 7:30. So his way of treating us was this chocolate bar, and it was one like a square chocolate bar. Maybe there were, I think, either 9 pieces total. So this is in the 80s, back home in Turkey. So what used to happen, what I remember, I can just that some unique smell, the scent and the taste you can remember. So this is one of those. So we would get 2 pieces max, because it was 9, and there are 4 kids. So if the parents are not eating, there's 2. If parents are eating, there's less than that. But it was so different. Even today, I still remember that taste. Now, same chocolate is available today. Same, everything is same. And my housekeeper bought 1 bar from the Turkish store that we have here. It's the same thing. I ate the whole thing and didn't feel anything, didn't taste anything. So I think, like, going back to the original issue of the access to food, and not just the access, but how much access we have, how much we can afford now. I think that's something that's really interesting, and people really need to maybe pay attention to that, because I remember that time of same chocolate not giving me the same satisfaction anymore, because it's readily available everywhere. Then it always reminds me of, okay, mindful eating, that mindful, because it was so little, so you have to be slow. You couldn't just eat the whole thing right away. So that actually kind of like covers maybe 2 of these issues, because it was so little, you had to take your time. So otherwise you have to go after one of the siblings and then try to take their piece. So that's why I think people maybe just put it in perspective, mindful eating and the access to food. I think between the 2, this chocolate example is, at least for me, it's always kind of interesting, because it's just a personal feeling. Now, Dr. Erkan, one of the things that I see, people are not tracking their activities, which is like so easy to do. And then you and I, we talk about this a lot. So everyone's phone is able to track their activity. So why it helps, because if you are able to set goals, then you are able to put more efforts, but you have to be able to measure that. So between the 2, activity and the keeping tracking of the activity, I think that they are also helpful for. Because
absolutely,
we struggle with these day to day. And then the only reason I'm looking at this is because I'm going to be over 8,500 steps every day, which my average last week was.
Yeah.
I had to go out twice to walk, because if I'm in the office, like today I didn't walk, I have only 621 steps. Wednesday, I'm at 11,000 steps. So,
but what is the key here? The key is that you have technology now that allows you to track that, right?
Mm-hmm.
I mean, of course, technology is hurting us when it comes to obesity, because everything is, automated, and we have remote control for everything, and we don't move. But on the other hand, technology can also help us, because it provides us these tools that help us, right? So
Mm-hmm.
I talk about, to our patients about using a smartwatch, a smartphone to track their movement, right? The key word here, Kemal, is movement. When we talk about exercise, sometimes people think that exercise is only when you go to the gym and sweat it out for half hour or 1 hour, 5 times a week and so forth. Well, if you can do that, excellent, right?
Mm-hmm.
But let's start with the foundation. And that's what I talk to people. And I tell them, look, what is movement like for you during your waking hours? From the minute you get up from your sleep until you go back to sleep, what is movement like? You actually have technology now that allows you to track that. And the basis of movement for human beings is walking, right? Which means walking to do your own chores, walking to do things, and walking with the, intentionally for the purpose of moving, right? But if we can track that, and if we can see how much we're doing every day, and we are really diligent about that, then we can actually tweak our day to add more steps to our activity, right? So for instance, you mentioned 10,000. 10,000 is a fantastic goal. I think in the long term, we should strive to achieve that. That's what I talk to my patients about, right? Yes, I'm happy if they're going to the gym 3-4 times a week and they're committed in the long term to doing that. But I'm actually much happier if the largest proportion of our patients actually do 10,000 steps a day on the vast majority of days. So if they are tracking their movements, then they will be able to adjust their day to add steps, right? We talk about parking further away rather than closer, right? People fight for parking spots that are closer to the venue very often. And what we're saying is do the other way, just flip it, look for the furthest parking spot as safely as you can to do that. Or if you're going to stores, nowadays we were talking about Wegmans the other day with you, look how huge that place is, Kemal, right? So if you need to go to a particular aisle in a store like that, the instinct is to go with a shortcut, right? To go as far as you can. Well, sometimes if you have no time, you may want to do that. But if you have time and you want to add more steps to your day, then you take the longest route. Now, when you are adding steps to your day, Kemal, not only you're getting closer to that 10,000 milestone that you're looking for, but every time you are walking is time you're not sitting, right? So the trade-off there is important because, during your waking hours, when you're not asleep, you're either standing still, right? Or you're moving, right? So if you're moving, you're not standing still. So every time you add more steps to yourself, not only you are adding more walking time to your day, but also you're taking less sedentary time, right? And that trade-off is very important. So I agree with you. I think in the long term, particularly living in a society where everything's so automated, we really need to track our movement. We need to see how many steps we're doing. The vast majority of us work in sedentary jobs in front of desks, in front of computers, right? A lot of people work in that kind of situation nowadays. Unless we really have this mindfulness again about our movements, tracking our steps, then we would be relegated into a situation where we're eating more and less active, and that is a disaster because eventually the weight will come back in some form or another.
So I think what's important for everyone to remember is the bariatric surgery is a tool. Yes. It's not a magic. It's not magic. So it's a tool. So that means everything else that we are going through in our regular life, what Dr. Erkan is going through, what I'm going through, what anyone else even with or without bariatric surgery, we are still struggling with those. That means once we utilize that tool, then we have to adopt certain things to make sure that we are not going back to where we started. So one of the things
to add to that, Kemal, then, it is, as you said, it's a tool. And also people need to understand that obesity is a chronic condition that has entrenched roots within our biology, right? And the surgery doesn't necessarily fix that biology, right? It helps us. It's a powerful tool, right? But that tendency for our body to want to be at a higher weight will still be with us, right? We have to understand that. Now, so yes, people can struggle with weight gain. They should not be embarrassed because they weight gain. They should be comfortable that they have realized that they're struggling and they need to seek help. Yes, as bariatric surgeons, and as a program, we love it when our patients come and show us how much weight they've lost. We both celebrate, we're happy, but also we're much more useful to them when they're struggling, right? So don't be embarrassed if you have regained weight, call us sooner than later, because early intervention, early help and assistance actually can be very helpful, right? You want to come and seek help if you've gained 15 pounds as opposed to 50 pounds. It's a lot easier to recuperate from that 15 pounds than it is from that 50 pounds. So that's important. Scheduling regular visits, right?
Well, I would say that from that point, so our program, just like any other certified program, there are certain checkpoints in the 5 years after the surgery, but we're not limited with those only. That's just with your surgeon, surgical office. But if you are you think you are going to have a challenge, our dietitians, nutritionists are available after the surgery, and same as for our bariatrician who's focusing on non-surgical side of it. So she's available. So as you were saying, instead of waiting until it's too late, like come to us when you feel like the trouble started, so then we can actually have an early intervention and not to let this problem go out of control, because things are going to be always more difficult.
Yeah, and also, know that there is a whole community there that can support us, right? We have support groups, for instance, right, Kemal, that particularly now with the, ability to do virtual meetings, right? That should be relatively easy for most people. So our support group, for instance, is the first Tuesday of every month, and it's available to all patients associated with our practice, where they can sign up for it, right? And you even if you don't come to every support meeting, let's say if you can make it maybe half of the time, if you can come 6 times a year, for instance, or even 4 times a year, that is still, you're connected and you're likely to hear struggles of other people and maybe recognize that you may be having the same struggles as well. And then you can come up with solutions that you may not have thought of, or you may provide and suggest solutions that other people may not have thought of. So staying connected with the bariatric program is very important. Understand that our relationship does not end with the performance of the surgery. Far from it. That is only a part of the relationship, right? We have to continue to see our patients in the long term, not only because we want to make sure we support them for times in which they may struggle, but also because clearly there are important reasons for follow-up, whether it's checking their vitamin levels or understanding any potential complications that can happen in the long term.
Absolutely. And I did share the support group, QR code, but also anyone can go to our website and then get the information from the website as well. So I'm going to actually share one other thing. Let's see if I can quickly go there. So we made one changes outside of our topic today. I want to make sure that our patients are able to follow this new changes that we have. So you are able to make an appointment without calling us.
Yeah.
You can, if you don't have an IQ Health, which is our patient portal, you can go to CHRIAS website And right over here, the schedule an appointment, when you click on that, it's going to open. It's going to give you these options. So if I'm able to see a little bit better, so life would be a lot simpler. So here, all right. So if you are a new patient, you can click on this. And what's going to ask you is to just enter some very little minimal information. So that way we can actually call you back. So you need to indicate, yes, I would like to receive a confirmation and I'm calling for CHRIAS. You don't have to choose the provider if you don't have a specific one, and then type reason is I'm a new patient. You put your name, your date of birth, and your phone number and your email. That's simple. So as soon as you hit OK, we'll be receiving that email. So you don't have to have patient portal to do this.
Right.
So I think this should help our patients, but also this is where you can ask for help for nutrition visits, like after surgery, if you are struggling. So we made everything a lot easier. Same thing for our established patients. We want you to use the IQ Health first. This is our patient portal, but if you are not, then you can go to the same form that we just did earlier, and hopefully life will be easier for our patients and for us as well. So, Dr. Erkan, one thing that I was going to ask you before I forget, binge eating. So, binge, right? Binge eating, like the
Binge eating.
Binge eating, binge
Yeah.
I call it binge eating for whatever reason, binge eating. So
Yeah.
this is kind of like, not just with patients with morbid obesity, but also I see with like young, like I'm going to use some stereotypes, like young models who talk about this. They get up at night and then just eat the entire fridge, and then they throw up next day, I guess. So, but what is it, and how our patients can protect themselves from that issue?
Right. Actually, there is an eating disorder, Kemal, that is clearly a disorder, binge eating disorder, where people really consume a very large amount of food when they are not even hungry. They eat a lot of food a lot faster than most other people, and they eat until they are very, very uncomfortable, right? So that is a disorder, and especially something that happens, on a persistent manner. This is a serious problem, and of course, it needs to be addressed before bariatric surgery if such a disorder exists, right? Now, overeating, by itself does not mean you are binge eating, right? Because, how many people can really raise their hand and say, I never overeat, right? Very few people, the vast majority of people probably eat more than their energy needs, and that's why we are in the situation where we are. Although not everybody obviously suffers from morbid obesity, but so essentially that's that. So is there a danger of that after bariatric surgeries? Yes, definitely, right? Clearly, if there were identified eating disorders, and people will volunteer and tell you when they are, those need to be addressed. Counseling is necessary. Specialized, therapies is necessary to address these issues before bariatric surgery, right? Because these disorders by themselves, if they are, established disorders, they can be dangerous after bariatric surgery, right? I mean, if you're eating until you're uncomfortable, you may eat so much that you can physically disrupt, the sutures that are holding your stomach, and that is a serious, serious problem, particularly if it happens very early after surgery when there is not very much room in the stomach, when the surgery itself is relatively fresh, and that could definitely be a disaster, right? But in general, what we talk about, Kemal, is we talk about not really avoiding eating when you're not hungry, right? I mean, that's easier said than done, because exactly for the reason you mentioned earlier on, the availability of food everywhere and anywhere makes it extremely hard to stick to that, right? I mean, even when you go to the bank nowadays, right, they offer you candies. I mean, there is no place where you're not offered food. And of course, food is a central part of our social life as human beings right now. And the more available it is, the more indulgent we are with it, obviously, right? That is a problem. And that's what really sabotaging us also, because, Kemal, we're doing very, very good surgery, and then we're letting people live in a society like that where it is very hard, obviously, to refrain. But we have to constantly remind them about that, right? There is something called grazing, for instance, that I talk about to patients, and that's a danger of really munching on something continuously, right? Again, either because we use food as a way to really feel good about something that is really upsetting us, or whether because we're socializing, or because it's just there also, right? And it just becomes like an automatic thing, as you were saying earlier on, when you're when you are limited and deprived, and you don't have really so much stimulation with the food, the little that you get, actually you taste it, you savor it, is really very good. But if you're doing it in and out, then you lose even that taste, because you really get not even your taste buds or your sense of smell is really becomes so used to it that you don't really appreciate the value of it over time. And that's what we're reduced by living in a society where there is so much overwhelming presence of food. And yet we have to recognize that and protect ourselves, because we cannot afford to stay obese, Kemal, because it is a life-threatening condition. It's a chronic condition. It comes with many diseases, and it really can turn our lives upside down if we're not able to get rid of it. But we have a great tool with bariatric surgery, and what we're saying openly here, Kemal, is that even bariatric surgery is not immune from potential for gaining weight. There was a famous surgeon, one of the very early surgeons that pioneered bariatric surgery in this country, who used to say, you can out-eat any bariatric procedure, right? Meaning that you can defeat it, right? If you're determined, right? And that's what we're saying is don't, work with your tool, with your bariatric surgical tool, to maintain a healthy weight in the long term.
And we know that this is the way to go for those who have morbid obesity, who's dealing with morbid obesity. This is the not only, but it's the most efficient tool. So when we use this tool, we want to make sure that we, throughout that process, we adopt certain habits that's going to help us to make this long-term and then make the journey more successful. I think that's really important. But anytime you have trouble, we are here. So all of our patients. So we meet every day. We discuss all of our cases every day. We go over those cases every day, and we put so much into this. So every patient is extremely important for us. So please don't wait until it's too late. So reach out, and then we'll be here next week again with another topic. Dr. Erkan, thank you so much for joining me.
Thank you, Kemal.
We'll see you next week. Bye-bye.
Bye-bye. Thanks.